Hi everyone, Dr. Suissa here. I'm going to talk to you about awake fat transfers to the breast, which we call naturals at Squlpt. So let me start by explaining what we do and how we do it. We start by evaluating you, your skin, your body shape, evaluating the needs and your wants. What are you trying to achieve? How can we get you there? Is it possible or not? And we'll always tell you honestly, because sometimes it's not. Once we figure that out with you and we have a plan together, we need to start by getting that fat out. We give you some light medications to keep you super comfortable. We're using that mellow kind of state that you're in to make tiny little holes and insert a very thin, blunt needle, so it's not sharp, and we're gonna put in the numbing solution. And we have a special mix of numbing solution that keeps the amounts very low and very safe. And safety is number one here at Squlpt, so it's very important. We have software that calculates it for us based on your weight, and so that's something we take very seriously. And we put that numbing solution through those little holes, and we progressively move that numbing solution to all the areas to make sure that you feel absolutely nothing. We'd like it to be absolutely nothing. Sometimes you might feel a little pinch here and there, little moments. We make adjustments, we give you a little more meds, we put a little bit more numbing solution, but ultimately the goal is to make you super comfortable. And during that time where you are completely numb, we're gonna go in and we're gonna use a very thin cannula through those holes, and these cannulas gently remove the fat without damaging all the other structures. And as you can see here, it's not sharp at all. I have my finger on it, so it feels very soft and it's very thin. And although it might look scary, it's actually going right underneath the skin. So in the fatty area, that's very safe. Because you are awake during this procedure, we get feedback from you. So we can't put the cannula in the wrong place. When people do liposuction under general anesthesia, they are completely out. You are being kept alive artificially with a tube down your throat into your lungs, and what that means is that you can't give us feedback. When you're awake, you have muscle tone, whereas under general anesthesia, the muscles are completely flaccid, they're soft. They don't really contract at all, and so again, the cannula can kind of poke in or poke through, and there's no muscle tone to keep all the structures nice and straight so that we can put our cannula through and stay in that right layer and keep it super safe. So that's another issue that we see with general anesthesia that we don't see with awake liposuction. Because you're awake, the removal of the fat can be done in multiple different positions. So we can ask you to bend, we can ask you to lift your arm, change positions, and that gives us many different angles to give you that best contour, as close as perfect as possible shape, and really smooth lines. Whereas under general anesthesia, remember, you're kind of just, sitting there, and yeah, you can lift somebody's arm over, but it's not as good, not even close, as having you move around and participate in the procedure to really get those perfect angles. We take that fat out, it's stored in special containers, and then the second phase of that is washing that fat. Make sure it has absolutely no bacteria, no contaminants in there, and that fat then gets separated from that liquid that we use to clean it. So the liquid is at the bottom and the fat floats on top because it's lighter, and we drain out all that liquid, and that fat that's left is the concentrated, pure, clean fat. We use that fat and inject it in multiple little layers into the tissue. We call this process awake liposhaping, and that is all we do, and we're experts at what we do.